This is going to be a USMLE review of the gynecology section. This is the third video in this series. Here we'll cover Turner syndrome, menopause, fibroadenoma, SERMs, infertility, and Sertoli-Leydig cell tumors. I have no disclosures. We'll begin with Turner syndrome. Normally, a female has an XX chromosome and a male has an XY chromosome. With Turner syndrome, the abnormality is that the female only has one X chromosome. One of the physical manifestations is streak ovaries, which is when the ovaries are long, thin, and non-functioning. The body is going to produce a lot of LH and FSH to try to get them to work, but they're not going to work and they're not going to be producing estrogen. A lot of the physical examination findings that you see with Turner's patients are secondary to not having estrogen. For example, the patients tend to be short, which is because estrogen helps with growth. They also don't develop secondary sexual characteristics, another thing estrogen is responsible for. Examiners like you to know that since estrogen inhibits osteoclasts, they are also more prone to osteoporosis. And the treatment for this is to give heart hormone replacement therapy. Menopause is when a woman stops having a period for 1 year straight. Besides for checking the LH and the FSH levels, it's important to check for thyroid function because thyroid disorders can present in a similar fashion. Here I have a Monopoly board. That's because there are 40 properties on the Monopoly board. This signifies primary ovarian insufficiency, which is when you experience menopause before the age of 40. Importantly, with primary ovarian insufficiency, there is an association with the FMR1 gene responsible for Fragile X. Here, the person is withdrawing money. This is to remind of the progesterone withdrawal challenge. Essentially, you give a patient progesterone for a week, and when you stop, they should have withdrawal bleeding. Patients with primary ovarian insufficiency or patients that have undergone menopause are not going to have withdrawal bleeding. Fibroadenoma is typically described as a smooth, round, mobile mass within the breast. If you were to look at it on ultrasound, you'd have this posterior acoustic enhancement. Besides for being benign, they are very difficult. Even on ultrasound, you can't really differentiate it between a cyst. The only way to actually make the diagnosis is with a biopsy. However, one clue that it's a fibroadenoma is that it will be a young patient. Young patients under the age of 30 tend to have fibroadenomas, whereas cysts tend to affect women over the age of 30. This girl is doing a magic trick. This is to remind that fibroadenomas tend to disappear after menopause once the hormone changes go away. Typically, these are not painful, but they could be. Here I have a income tax return. This is to remind if a patient comes in with something that you think is a fibroadenoma, but you're not exactly sure, have them come in a few days after they have their next period and re-examine. SERMs are very important for treating certain breast cancers. One of the effects of SERMs, though, is that it increases venous clots, and so it is contraindicated with patients that have previous clotting problems. Over here I have a skull wearing a crown. This is to signify raloxifene, who rules, is better for the bones. Here the Tums is to signify tamoxifen, and it is more associated with the endometrial cancer. That's because tamoxifen, although it's an antagonist on the breast, it is an agonist on the endometrium, so it does have an increased risk of leading to cancers. It's important to know the definition of infertility. Here I have one of those picture rolls. Below it are 12 eggs, above it are 6. And the reason for that is these rolls are 35 millimeters. That reminds me that below the age of 35, going 12 months trying to conceive and being unsuccessful, that classifies as infertility. And also, if you're over the age of 35, going 6 months without being able to conceive classifies as infertility. One of the first steps in the workup for infertility is the semen analysis. You'd like to make sure that the man's sperm, there's the right number, the right morphology, and importantly, if the patient has a history of pelvic inflammatory disease, get a histosalpingogram. This one is interesting that there are 2 uteruses, or uteri, and this in rare occasions can actually be associated with a double vagina. The last topic we'll cover today are Sertoli-Leydig cell tumors. We mentioned before that there are different areas in the ovary that produce different cancers. These ones originate from the stroma. Classically, they have a very fast onset, like this turtle, a very fast onset within a few months or a year. A woman will be complaining of increased hair or acne. This man over here has the longest hair in the world, and typically question stems describe a change in the voice. This is the vocal cords. The voice changed because the cords tend to shorten and thicken. They also complain of breast atrophy, and this is a classic description of a Sertoli-Leydig cell tumor. That is all we're going to cover today. I wish you the best of luck. If you have any questions, please feel free to reach out.